Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. Today, we're going to be talking about constipation and bloating. This is a topic that I see in clinical practice every single day, sometimes including weekends. And by that I mean, I get asked about constipation and bloating constantly. Chances are, if you're a gastroenterologist, you're getting asked by random people on the street about their bowel movements. It's a occupational hazard, as we say. So let's talk today about a case of a patient with constipation, and we'll talk all about how to manage constipation, which is causing this person to feel bloated and uncomfortable. We'll talk about some things you can do with diet and lifestyle to fix the problem, and we'll also talk about some over-the-counter remedies that you can use for constipation and bloating. Before I start, I should tell you that this case is based on a real patient, but I've changed enough details to protect patient privacy. So our patient is a 34-year-old woman who comes in today with a long history of complaints like bloating, gas, and intermittent abdominal pain. The pain is mainly in the lower part of the belly, below the belly button, kind of on both sides, sometimes favoring the right, sometimes favoring the left. It comes and goes, it moves around, it's present most of the time. Sometimes when she thinks about it, it's there every day. Sometimes it's not there for a week or two at a time. But it's been an ongoing thing for the past few years. And in the past few months, it's really started to affect her life, and she decided to seek evaluation. She's not been seen by a gastro before, but she had some blood work and testing done by her primary care doctor before she came in. She recently had a physical, including lab work, which is all normal. They checked her thyroid studies. Her doctor checked her celiac labs, which was very good, and that was negative, meaning she does not have celiac disease. Basic blood work, CBC, hemoglobin, electrolytes, all that stuff is normal. And a ultrasound was also done for the bloating, and the abdominal ultrasound was normal. There was no fluid in the belly or anything unusual there. Incidentally, they noticed on the ultrasound that there was some bowel gas that kind of obscured the view of the pancreas. And this is something you see actually all the time on ultrasound, so it's not anything abnormal, but that's what hers also showed. So she came in and we talked about the history a little bit, and we talked about the differential diagnosis of bloating. I should mention that her physical exam was basically normal, looked like a normal, healthy person, no real major issues on abdominal exam, maybe a little bit of mild tenderness when you press in the lower part of the abdomen, but that's expected, and lots of people have that with no specific cause. So we discussed the differential, so what could this be? And we talked about all things from constipation to functional bloating to lactose intolerance to small intestinal bacterial overgrowth. We talked about gas-producing foods. We covered celiac disease and pancreatic diseases. We talked about bowel obstruction and malignancy and all kinds of other more serious conditions. And we also discussed the possibility that there was some weight gain going on or whatnot that caused her bloating. But after this discussion of the differential and looking at her previous history, that was basically normal with normal blood work and normal ultrasound, that rules out a lot of possibilities. And given the rest of the history that we took, which includes her bowel habits, we figured out that constipation is most likely the source of her issue, or at least the easiest thing to start treating, and then we'll see what happens. So when she told me her history about her bowel movements, she basically says that she has a bowel movement every 2 to 3 days or so, sometimes a little longer in between movements. Sometimes she goes every day, but typically it's a struggle and the stools are on the harder side. She sometimes has little pellet stools that she describes as little rocks of stool that are hard to pass. She often has to strain when she's going to the bathroom. Sometimes she'll have these little pellet stools followed by like a looser stool or diarrhea, but oftentimes just little pellets, small amounts of stool, never really feels fully empty when she goes to the bathroom, and we call that incomplete evacuation. And she denied any blood loss, that is, any blood in the stool, red blood or whatnot. She denied any recent weight loss. She denies significant diarrhea on a regular basis. And she also notes that sometimes her bloating and her lower abdominal discomfort got better when she moves her bowels, although it soon returns. So before we go any further, we'll discuss the difference between bloating and abdominal distension, because lots of people complain of these things and they're not really exactly the same, although they are related. So bloating is a feeling. Bloating is a feeling of abdominal fullness and pressure and a sensation of trapped gas or something taking up space in the abdomen, causing this uncomfortable sensation. And bloating is subjective, meaning that if someone says they feel bloated, there's nothing I can do to prove it or disprove it. It's the way someone feels. Now, distension is different. Oftentimes, distension and bloating are reported together, but distension is like a measurable thing. So if someone is distended, you can actually measure that with a measuring tape. That's how we use the term distension. So formally, it's an increased abdominal girth. So if someone has a distended abdomen, they look like they are distended. Their belly is bigger than it should be. And oftentimes people complain of both together, and there are several conditions that cause both of these things together. But if we just take bloating alone and don't think about distension for the moment, because bloating seems to be a more common complaint, if we look at bloating alone, about 30% of the population complains of bloating occasionally. So it's a very, very common complaint. If you take 100 random people, 30 are going to say that they feel bloated occasionally or frequently. And the statistic in people with irritable bowel syndrome or IBS is that almost everybody with IBS complains of bloating at some point. So it's about 96% of people who suffer from IBS have bloating symptoms. So bloating is in no way a specific symptom for any one condition because it's super common and it's associated with many different problems. So back to this patient, she's complaining of lots of bloating, and we discussed her bowel habits, which sound like she's not really fully emptying her bowels. She's not having satisfactory movements. The stools are hard. They're difficult to pass. All of that leads me to think that the most likely thing that's causing her bloating symptoms is really constipation. And if we wanted to be formal with the terminology, we would call this irritable bowel syndrome with constipation. And this is probably the most common thing that I see in clinical practice in people who are coming in with bloating. Not to say that bloating can't be caused by one of these more sinister causes like cancer or ascites, which is fluid in the belly from some other condition, or many other conditions that we discussed a little earlier, like celiac disease or pancreatic insufficiency or some type of bowel blockage or cancer, or a problem with your bowel motility, or a problem with the gut being inflamed, like inflammatory bowel disease or Crohn's or ulcerative colitis. Now, a lot of these things can cause bloating symptoms, but in her case, she's otherwise healthy, and we decided that this was constipation causing the problem. So when someone walks into the office with these complaints, what do we do? What do we talk about? A lot of this is talk therapy in the beginning, and then we start to work on what we can do about the complaints. So how do we approach this whole thing? But before I go into the rest of this episode, I'd like to just briefly review the current understanding of what causes a feeling of bloating, because it's kind of interesting. And what people feel is often that feeling of gas, like their stomach's inflated with gas. But in studies, that's not really what's happening. It's sometimes they find on studies that there is increased gas in the abdomen. And you can measure this on imaging. You can MRI or CAT scan or whatever it is, and you can actually quantify or measure the amount of gas inside someone's abdomen. You can see it physically there. And some people who do complain of bloating do have a little extra abdominal gas, but usually it's not a significant amount. So it's not technically gas that's causing the feeling. It's just a feeling. And why do people get it? There's still a somewhat poor understanding of why bloating happens, and people think it's probably due to some type of heightened neurologic sensitivity to gas or other regular stimuli inside the gut. So food digestion and liquid and solid and stuff inside the intestine is causing some type of neurologic interference that's causing this bloating feeling. So you have your enteric nervous system, which is part of your intestines. It's like it's like the brain that attaches to your intestines and kind of tells it what to do and controls the motility and lots of sensation and other things that the intestine does. And then you have your central nervous system, which is your brain, and they talk to each other. So the brain and the gut brain, which is the enteric nervous system, speak to each other. And I've talked about this on previous episodes. And we think, or people think, not me because I don't do the research, but researchers believe that there's some type of visceral hypersensitivity going on where your gut brain, the visceral brain, is responding to normal stimuli in an abnormal fashion. So a little bit of distension from gas or food or other normal gut processes is causing this uncomfortable sensation to go back to your brain. And in reality, it's all good. Everything's okay in the gut realm, but your brain's not saying it's okay. So a lot of the things that we do in terms of treating bloating, if we've ruled out a lot of the causes, do focus on this visceral hypersensitivity hypothesis. So that's interesting, and we'll get to that maybe toward the end, or truthfully, that's probably more of a subject for an entire separate episode. But back to our patient. Let's go through this as I speak to her in the office and what we talk about. So we talk about all the causes of bloating. We talk about how it's probably not one of the more sinister causes because of the previous history, etc., that we went through already. And then we talk about how to fix the problem. So how do we get her to move her bowels a little better? And what is the advice that you would typically get in your first appointment to see a gastroenterologist about bloating and constipation? So she sounds like she's having what's called slow transit constipation, meaning things are not moving through the colon as they should, and she's building up gas from the extended time that the stool is hanging out in the colon, causing fermentation. Normal bacterial processes include fermentation and gas production. And there's hard stool sitting inside the colon, and the bowel is distended with stool, and it probably is what leads to this uncomfortable sensation. So we focus on helping the bowels move better. And it's not always the easiest thing to do, but if someone's not taken steps to optimize their daily routine and their diet and their lifestyle in terms of promoting a good movement every day, then that's the first thing that we focus on. So I have a bunch of recommendations that I would give this young woman, and we would talk first about fiber. We would talk about trying to get in enough fiber in the diet. Fiber comes in the form of fruits and vegetables and whole grains, and really it's best to get your fiber from whole food with some supplementation that we'll talk about soon, but whole foods are the best way to get your fiber, and that means eating a little bit of fruits and veggies with basically every meal. So you can't just think that you eat a salad at dinner time and that's enough fiber, or that you have an apple at lunchtime, that's enough fiber. That's just usually a drop in the bucket, and you have to get some fiber with every meal in order to meet your goal. And for most people, the goal for fiber is about 30 grams a day. So 30 grams a day. Men is a little higher, women is a little lower if you look at some guidelines, but anywhere from 25 grams for women to 38 grams for men, anywhere in between there, and probably more is better. So if you shoot for 30 grams a day, most people are going to be okay with that. And that's much better than the average person gets. The average person gets barely any fiber in the diet unless you're intentionally looking out for it. So the typical Western diet, American diet, has barely any fiber in it, and the statistic is somewhere like it's 10 grams or less or whatever it is. Don't quote me on that one, but it's pretty low in terms of daily fiber if you're not intentionally looking for fiber in the diet and just eating the typical carb-based meals that we eat. So you have to add some fiber to the diet, and if you go too fast with the fiber, I often warn people that you can get gas and bloating and other issues because if your body's not used to processing fiber, you can react poorly to it. Doesn't mean that fiber is not for you. It doesn't mean that you can't tolerate fiber. It just means that you have to go a little slower and let your body acclimate to a new diet. So it could take months, weeks to months or so to really be able to tolerate a very high fiber diet if you're not used to it. So if you go to the food store and I tell you to have 30 grams of fiber a day and you go from eating 8 grams a day in mostly processed foods to eating 30 grams a day because you want to be really good, you're not going to be happy. You're going to get bloated and you're going to feel awful and you're going to think that I have no idea what I'm talking about. But in reality, you just have to go slow. You have to build up that ability in your digestive tract to break down fiber and have less gas and bloating as a result of it. So go slow, increase the fiber content in the diet by only a few grams or so a week, and then you'll be able to get to that goal of 30 grams and do it a lot more comfortably. And I often recommend fiber supplements. So fiber supplements like psyllium husk or Metamucil or Citracel. There's many different brands out there, and these are available over the counter, and you can get extra fiber that way. And that kind of fiber often promotes bulk in the stool, and it helps to hold on to some extra water and to push things along. And the caveat there is that fiber supplements can also cause some bloating, especially if you're not used to them, especially if you're just starting them. So try to up the fiber in the diet. If that's not really doing it for you, add a little bit of fiber supplements in the form of psyllium husk or something related once a day and just see where you're at with that. Don't be a hero. You could do a half dose to 1 dose a day and just do it for a week or two and see what happens. And then you can always add it a little more. You can always add a little more fiber in the form of a supplement, but it's hard if you've had a bad experience with it to try to do it again and again, and it's not going to be something that you're going to enjoy doing, and you probably won't feel any better if you overdo it in the beginning. So a dose of fiber a day or so, and keep it steady and see what happens. Now, what else do I talk about typically on the first appointment besides getting dietary fiber, fruits, vegetables, whole grains, fiber supplements? We also talk about water intake. So all that bulk in your intestine needs some water to help push it along. Otherwise, you get these dry stools. And fiber can actually do the opposite. It can actually constipate you if you take a ton of fiber and don't take enough water to kind of hydrate it and move it along your digestive tract. Remember, the fiber kind of soaks up water. So the fiber and water together are what actually do the trick. So if you just take fiber by itself, it just sucks water out of your body and turns into concrete. So if you take enough fiber with enough water, it kind of forms like a slurry of fibrous stuff that will help push things along. So you want to aim for about 2 liters of water every day. If you can't just drink 2 liters of pure water, just drink a variety of different fluids to get enough water or liquid in your body so that you're urinating pretty clearly and you're getting about 2 liters total a day. I also counsel people to get some regular exercise. You don't need to be formally doing a major workout every day, but even if you just wake up and do some stretching or yoga for 15 to 20 minutes, or if you end up going for a walk every day, or you go to the gym every other day and go for a walk on the other days where you're not at the gym, all of this movement in your body helps to stimulate the colon. A lot of people eat a low fiber, high processed food diet, have a sedentary job, get up, shower, walk to their car, sit at a desk all day, and then do the reverse and go home. And if you don't really stimulate the body to move, your colon, which is part of your body, if you didn't know, doesn't want to move either. It's just, everything just kind of slows down, just like your muscles atrophy and your posture suffers and your brain turns to mush when you sit around all day. Your colon does the same thing. So you have to move your body and you have to walk around and do stuff and get out and exercise, and you can go for a walk around your neighborhood. It doesn't need to be a major Olympic triathlon. Just go for a walk. So that's important. And then if you've done all those things, so fiber, water, and exercise, those are like the bare minimum things that you have to do. After that, if that doesn't work, which it often doesn't really fix the problem for everybody, it's a really good baseline. I always say that you have to do the foundational stuff first, and then you start adding stuff to that. But if you've done all this foundational stuff and your problems are still there and you're not having good bowel movements and you're still feeling bloated and miserable and you've been doing this for a couple of weeks now or longer and nothing's really changed, then we start thinking about more high-level stuff. And what do I mean by this? Well, at some point you have to consider your bowel habits as part of your daily hygiene requirement. Just like we have sleep hygiene, meaning you turn your cell phones off at night and you brush your teeth and you get into your pajamas and all these things that you do to kind of help facilitate good sleep at night. You kind of wind down for the day. And just like we have oral hygiene where you brush your teeth and you do all your flossing and you go to the dentist every so often, yada, yada, yada. We also need to have bowel hygiene, but it's not really a cool thing to talk about, your colon hygiene. So nobody talks about it, I guess. But I do. I talk about it. So if constipation is a problem for you and your bowels don't automatically just work like clockwork, then it pays to structure your day around having a good movement. And it sounds ridiculous, but how much better do you feel when you wake up and have a normal, good, healthy bowel movement? The rest of the day is often a lot better, rather than being bloated and uncomfortable all day, having gas, and just feeling sick all day. So it's helpful to wake up a little earlier if you need a little extra time in the morning. It's often helpful to have a cup of coffee or a cup of tea or two in the morning to help stimulate the gastrointestinal tract to start moving along. It's also helpful to engage in your exercise earlier in the morning. And the other thing that helps is eating something. So a lot of people skip breakfast. They wake up 20 minutes before they have to be at the door. They jump in the shower. They run out to their car, and they show up to work just in time. But they didn't give their body any time to wake up. So the natural things that happen when your body wakes up are often that the GI tract also wakes up with your body, but it takes a little bit of time. So wake up a little earlier, give yourself a cup of coffee in the morning, go for a 15-minute walk. You can do those things together. They make these things called travel mugs. You can put your coffee in a mug and go for a walk around your block for 15 minutes. It's amazing. But you do that in the morning, then you have a little breakfast. It doesn't have to be something huge. It could be a piece of fruit. It could be some oatmeal. It could be whatever you want it to be. But the food plus the exercise plus the coffee plus giving yourself a little extra time, that is like the perfect scenario to have a bowel movement. So hopefully a few minutes later, 15 minutes after you do that little ritual, half an hour, whatever it is, you get the urge to go. You go to the bathroom, do your thing, take a shower, go to work. So you gave yourself a little extra time in the morning, but you improved your entire day by having the great American bowel movement early in the morning. So that's really a second level thing to think about once you've kind of straightened out fiber intake, water intake. Getting some exercise is really just to work on the timing for this colon hygiene situation that we're talking about. So doing that little ritual in the morning is very helpful for lots of people, as opposed to just seeing whenever you're going to have a bowel movement and just leaving it up to chance. So if the constipation is a problem for you, then you can kind of structure your day this way. And if constipation is not a problem for you, then you can just do whatever you want, because you probably don't have to do this whole scenario. Now, if you've done all these healthy habits, you're waking up, you're exercising, you're having coffee, you're doing your fiber, you're getting your 8 hours of sleep and other things that you should be doing to promote just normal stuff happening in your body, you're reducing your stress levels. God knows how you do that, but when you figure it out, just let me know. Drop us a comment here on how to reduce stress levels. But you're doing all these things and you're living an amazing life, and you're still not going to the bathroom. And you need to take it to the next level. Now you're on the third level of what we do. And again, this is all stuff that we often talk about very quickly on the first appointment, but if you wanted to get more in-depth information, that's why we have this podcast. But now it's time to kick it up a notch, and you want to start taking something to help you go to the bathroom. And I don't count fiber here because fiber is just fiber. So I'm presuming you're already taking fiber supplements at least once a day. You're taking psyllium husk once a day, whatever it is, and nothing's working. Still not going. Maybe you're going a little better, but it's not great. You still feel bloated. You still feel like you have to poop all the time. What do we do now? So at this point, this is when I start talking about taking over-the-counters. So over-the-counter products to help you move your bowels. And pretty much the first line thing that people think about for helping them go to the bathroom, stuff they could buy at the drugstore, are just regular stool softeners. So the classic one is Colace, and it looks like a little red clear pill. And it's given out to lots of people. It's given out to young pregnant women. It's given out to old grandmas who are constipated and everybody in between. And it's been around for a long, long time, and it barely does anything. It works to make things a little more slippery inside, or at least that's the theory. But in practice, it barely does anything. And in fact, at the hospital where I work at, it was actually removed from the formulary because it's kind of just a waste of money. It's a cheap but not effective placebo. Now, that being said, some people do take Colace over the counter once or twice a day, and they report that it causes such great effect that they have diarrhea from it. And I can't explain that, but more power to them. So if that works for you, great. But most of the time, it does nothing, or barely anything, or barely enough, and there still is some room for improvement. So if you're taking Colace, or you're just going to skip that one, which I often don't even recommend people take it, then what do we start over the counter if we had to pick one thing to start? Well, for me, that is Miralax. So Miralax is polyethylene glycol. It's been around also for a very long time. It's very safe. It's been studied in terms of effectiveness and safety, and it turns out that it is pretty effective and it's also safe. Now, just once a day or even a half dose a day of Miralax sometimes goes a long way. What it does is it's a non-absorbed molecule, so it sits inside your gut. You take it with water. It holds onto a whole bunch of water molecules, and it basically holds onto water in the stool. This promotes bulk in the stool, and the extra bulky and a little bit more slippery movement goes through a lot easier. Now, Miralax doesn't work for everybody. It's often not powerful enough if someone's truly, truly constipated, but taken on a regular basis, it's a pretty good way to treat constipation that's refractory to all of the diet and lifestyle changes that we talked about already. So Miralax is a good over-the-counter first-line treatment that is actually going to probably help you. If Miralax does not work, or if you're experiencing some type of intolerance or problem with it, then the next level thing to take is a magnesium-based laxative. Now, magnesium is pretty safe as well. It also works to just hold on to extra water inside the gut and help push things along. Magnesium could be problematic if you have issues where you can't excrete magnesium well, or if you're prone to having high levels of magnesium, or if you have decreased kidney function. So it's not for everybody, but taken sparingly or taken in small quantities, magnesium over the counter, like magnesium citrate or magnesium sulfate or magnesium oxide or milk of magnesia. Any of them really help to make you go, and some people tolerate one formulation more than others, but at the end of the day, the magnesium ion is really what does it. And magnesium is another type of over-the-counter treatment that you can use for mild constipation that's refractory to diet and lifestyle changes. Now, a lot of people come in, they were taking these other laxatives that they get over the counter that are called stimulant laxatives. And these are products like Dulcolax or Senna, also called Senecot. There's a herbal laxative called Cascara. These are all like stimulant type or irritant type laxatives. And these are pretty effective in terms of relieving constipation in someone who doesn't need to take them every single day. So what often happens is these drugs are effective. They stimulate the bowel to move. They actually physically make the muscles push, and you get a bowel movement. Sometimes the side effects, however, are cramps and pain in the bowels or diarrhea because they're somewhat stronger than Miralax or fiber. And while effective, there's a concern that people can become tolerant to the stimulant laxatives and can require more and more of them to move their bowels. So I've met people in the office who started taking stimulant laxatives when they were in their 20s, and now instead of taking like what the package says, they're up to 8 to 10 times that dose or even more. And I've met people who take 20 Dulcolax pills a day to move their bowels. Now that's not good at all because it's diminishing returns. You can start to get liver toxicity and other toxicities from too much of these stimulant laxatives. And if you really require 10 or 20 times the dose that's recommended to be used occasionally, if you're taking that dose every day at that much higher level, that's kind of indicative of another higher level problem that you really should see a specialist about. And there are more effective type of treatments for this kind of problem in terms of prescription laxatives for most people than taking 20 Dulcolax pills a day, or 5 or 6 Dulcolax pills a day for that matter. Now, that being said, some people who get to that point where they need so much of these stimulant laxatives to go, sometimes the prescription laxatives actually don't even help because they're so accustomed to this stimulant laxative situation that nothing else really works, and then you're kind of hooked on these stimulant laxatives. But there's definitely ways to get that requirement of the medication down, and you can start a prescription laxative that we'll talk about another time, and then slowly reduce the need for the stimulant laxatives over time. In theory, that sometimes helps, and you can get someone down off the stimulant laxatives to a much lower dose or even to stop them. But I've had people that you just cannot get off those stimulant laxatives no matter what you do. They just don't go to the bathroom anymore without them. So it's a shame. And the best thing to do is to address the constipation, as we talked about above, at a young age, and not wait for it to get to the point where you're taking such a high dose of stimulant laxatives. Now, for occasional use, they're great. They work great. If you're constipated, if you're backed up and you're having a bad time, or whatever the situation is, you take a Senna or two, or you take a Dulcolax or two, and you get some cramps, and you poop, and you feel amazing. But if you use it every day, you become accustomed to these drugs, and it's not the best way to treat things, and often doesn't result in great results. Either you often still feel bloated and sick when you're taking so many of these laxatives. So a couple of other things to mention about bloating specifically. There are certain diet changes you can make for bloating with or without constipation. And we'll go into this again one day. I'll have a dietitian on to talk about it. But for the meantime, things that cause bloating or foods that cause bloating with or without constipation. So if you're constipated, you're not clearing your gas out, and you have a lot of stool in your colon fermenting, that's going to cause worse bloating. But there's certain foods that if you're prone to bloating, and especially with constipation, you may want to watch out for. And some of these are hard to describe because it's like a double-edged sword. Some of these foods help you go. So they're high fiber foods, they're healthy for you, they're good. But on the other hand, sometimes people have a bad reaction to them, and it causes bloating and worsen problems. So there's certain things that I tell people to watch out for. It doesn't mean you can't eat them. It just means that you have to be aware of the fact that you might not digest these foods so well, and you may have to limit or avoid them either temporarily while things improve with your bowels, or forever. Maybe you just have an intolerance to these types of foods. So things like beans, onions, celery, carrots, raisins, bananas, apricots, prunes, Brussels sprouts, wheat germ, sometimes wheat in general, pretzels, bagels, processed food like that. Many people have problems with those foods causing bloating. And if you're looking for a diet change to make while you're fixing your constipation, you might want to avoid those foods, even though many of them have good fiber in them. And there's a crossover with these foods with other foods that are in what's called the low FODMAP diet that's often prescribed for bloating. And I won't go into that in great detail because that's a whole other topic. But a lot of those foods are high FODMAP foods, which are associated with bloating. FODMAP is FODMAP, and it stands for a whole bunch of stuff: fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So it's much easier to say FODMAP, FODMAP, than that whole thing. But these are substances that are found in food, like sugars, and other substances that promote bloating and promote drawing water into the GI tract and causing distension of the gut. And a lot of them are things that you know about, like lactose and high fructose corn syrup and other added sugar type foods. But there's a lot of healthy foods on this list: apples, pears, and cherries and other things. So it's often best to see a dietitian if you're doing a low FODMAP diet to figure out exactly what you should and shouldn't eat. What you often do is you cut out a whole bunch of foods and you see if you feel better, and then you start adding certain foods back that are on the list to see which ones you can tolerate. And over time, hopefully just identify the few foods that you shouldn't eat, but not be on a very exhaustive list of food restrictions, because that's tiresome and it's not always great nutritionally. You're limiting yourself from a lot of healthy foods. So how do we follow up with this patient? So she leaves the office. I gave her the information about diet, lifestyle, exercise, all the stuff above. We talked about taking Miralax every day if the diet and lifestyle and fiber supplements are not helping. And we set up an appointment for about a month to see what was going on. So she comes in about a month, and she's been taking the psyllium husk, and she's been doing some coffee and some exercise. And she's been eating lots more fiber in her diet. She estimates that she's probably getting about 24 grams a day or something like that. And she feels a lot better. Her bowel movements are not perfect. She's moving her bowels maybe once every 1 to 2 days, as opposed to much less than that. She's having more complete movements, which is much more important. So she's not having those little pellets of stool anymore. She's having normal formed movements, and she feels completion. So she goes to the bathroom and she's done, and she feels relief. She doesn't feel like she's always sitting on a big stool in her rectum, which is an uncomfortable feeling that a lot of people complain of when they have chronic constipation. And the pain in her belly has gotten about 90% better, and the bloating has gotten about 90% better as well. So she's very happy with these results. We got them with just simple diet and lifestyle changes. She didn't have to try Miralax or any other over-the-counter stuff, and she definitely didn't need to go on any prescription drugs. But what if she didn't get better? What would I talk about then? Well, I'd reiterate all the diet changes, and we'd see if she was really doing them. We'd talk about starting Miralax, and if she didn't do that yet, we would start that also. And then she would follow up again, and if she didn't get any better, after that, we would talk about further testing. Does she need colonoscopy? Do we need to do more intense imaging? Should we get a CAT scan of her belly? Should we do testing for bacterial overgrowth, called SIBO? These are all individualized things. So it depends. You have to really see a doctor at this point. This is not like just generic advice. You have to really see a gastro doctor and see what's up with your individual situation, your family history, your labs, all that stuff. Should we go further and do further testing? Are there any other alarming symptoms going on? But if the answer is no, and it's just simple constipation, well, at that point, we start some medications. And I will get into that in a future episode. We'll review all of the current FDA-approved prescription medications to treat chronic constipation and bloating. And that's ultimately what helps a lot of people who've tried all these diet and lifestyle things already and have not gotten the relief they need. But before we start prescriptions, we always do these diet and lifestyle changes. We always do the foundation first. And if the foundation is solid and you're doing all that stuff and nothing's working, then it's probably time to think about prescriptions. All right, so that's enough for today. We covered constipation and bloating and much more on this topic. It's a big topic for gastroenterologists. It's a big thing that lots of people suffer from, and hopefully you enjoyed this and it helped you if you suffer from bloating. And if you don't suffer from bloating, then send it to a friend that does, because 30% of the people you know are having issues with bloating and constipation, and they just don't want to talk about it. If you enjoyed this episode, please leave me a comment somewhere, but better yet, leave a review on Apple. Those reviews really do help to get these shows out to other people that don't know about the Real GI Doc Show. And as always, you can always leave me a question or a comment on social media. I use the name Real GI Doc. You can also go to the website linked below and leave an audio question if you have a specific question that you'd like me to cover on a future episode. Until then, talk to you next time. Thank you for listening.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.